Chaparral Regional Hospital is an urban hospital of approximately 60 beds that include emergency rooms, ICUs, surgical care, diagnostic services, rehab therapies, inpatient pharmacy, geriatric services, and physician referral services. We have proposed a QI plan and how it could be applied to the regional hospital. Within this presentation, I will be discussing why QI programs are developed, how QI programs are used in healthcare, and how a QI plan would relate to the Chaparral Regional Hospital. Applying Quality Improvement Methods, presented by Kayla Daly. What is a QI program? QI stands for Quality Improvement. Quality improvement consists of systematic and continuous actions that lead to measurable improvement in healthcare services and the health status of targeted patient groups. The Institute of Medicine has been recognized as a leader and an advisor on improving the nation's healthcare, which defines quality in healthcare as a direct correlation between the level of improved health services and the desired health outcomes of individuals and populations. Why are QI programs developed? Quality improvement is directly linked to an organization, efficiency, and outcome of care, and a level of patient satisfaction. One of the main reasons why a QI program is developed to achieve a different level of performance and improve quality, an organization's current system that needs to be changed. There are 4 key principles included within a QI program, and those include to QI work as systems and processes, focus on patients, focus on being part of a team, and focus on the use of data. QI work as systems and processes. This particular aspect of a QI program recognizes that both resources and inputs along with activities carried out, the processes that are addressed together to ensure or improve quality of care, involving the outputs and outcomes. Resources include people, infrastructure, materials, information, and technology. The next step would include activities, asking questions that include what is done and how it is done. Lastly, the results will occur involving health services and deliveries, changing in health behavior, changes in health status, and patient satisfaction. The focus on patients. Focusing on patients is the number one focus when involving quality improvement. Focusing on patients is a very important measure of quality that proves that all needs and expectations are met. The needs and expectations that can focus on patients include systems that affect patient access, care provision that is evidence-based, patient safety, support for patient engagement, coordination of care with other parts of the larger health care systems, and culture competency. Focusing on being part of a team. QI programs are developed to establish teamwork, confidence, and focus on being part of an efficient team. Team approaches that are the most effective involve the processes or systems is complex. No one person is an organization that knows all the dimensions of an issue. Process that involves more than one discipline. Team approaches also involve having solutions that require creativity and staff commitment and buy-ins are needed. Focusing on the use of data. Lastly, QI plans are developed to focus on the data that involves the hospital. Data is the cornerstone of quality improvement. Data shares what is working well and what is not working well within the hospital. Some perks of using data separates what is thought to be happening from what is really happening, establishing a baseline, and it also allows monitoring for procedural changes to ensure that improvements are sustained. What are QI programs used for healthcare facilities? QI programs are used for a number of things within a healthcare facility, such as improving patient health outcomes, improving efficiency of manager and clinical processes, avoiding costs associated with process failures, errors, and poor outcomes, and improving communication within the resources. What potential would Chaparral Regional Hospital have for a QI plan? Chaparral Regional Hospital could benefit tremendously from developing a QI plan because it thrives for better patient satisfaction and expectations. Chaparral could truly improve patient care, which is a major end goal. Utilizing a QI program to improve skill sets of employee within the Chaparral Regional Hospital. Chaparral Regional Hospital could also benefit from the teamwork and diversity that appear after a QI program is established. These are references and resources that I use to find information within. Now that I have presented a QI program and how it could be a major benefit to the regional hospital, Chaparral Regional Hospital definitely benefit from a QI program, and I hope this presentation has made sense in how to succeed. Thank you for having me on your television show to discuss a QI plan and focus on Chaparral Regional Hospital. Have a great day.